Mr. Eggleton, thank you very much for saying yes to this important order of reference, and we are, without a doubt, awaiting your comments, and then it'll be followed questions from the senators. Our former colleague, Senator Art Eggleton. Senator, la parole est à vous.
Well, thank you very much, Mr. Chairman, and members of the committee, and thank you for inviting me back. I spent many years sitting on committees of the Senate, including this one, but I never really sat at this end of the table. I never sat in the hot seat, but please have mercy on me tonight. But I am glad to have this opportunity to come in support of Bill S-233, an act to develop a national framework for a guaranteed livable income. As a former member of the Senate and chair of the Social Affairs Committee, where I spent a lot of my years, and a one-time member of this committee, as I pointed out, I have been an advocate for social justice issues, particularly the reduction of poverty, but have always kept in mind the need to do that in a financially responsible way. And to further emphasize that, I would remind you that I was summoned to this committee many times. I was once the president of the Treasury Board between 1993 and 1996, so I appreciate those needs and fiscal responsibility. Now, one of my great privileges as a senator was to work across the aisle with our colleague, the late Honourable Hugh Segal. The two of us worked to help produce a report in 2009 titled In From the Margins, A Call to Action on Poverty, Housing, and Homelessness. And amongst its recommendations was one to pursue the possibility of a basic income based on a negative income tax system. Our purpose was not a universal system of demo grants, but to top up people to give them a chance to escape poverty. Hugh used the phrase, and I quote, "Give them the boots so that they can pull themselves up by the bootstraps." Neither Hugh nor I would support a system that was beyond the fiscal capacity of government. We both saw it as a plan for people to escape poverty, reduce income inequality. Because for these people, our fellow citizens, every day is a battle with insufficient income, unaffordable housing, inadequate clothing, and a scarcity of nutritious food. It takes a toll on their lives with a loss of dignity, marginalization, stress, and anxiety. Our current social assistance and welfare systems frequently trap people in poverty. The systems are a patchwork quilt of humility for so many people. Incremental improvements are not enough. What happens is sometimes one government will come in and say, okay, we're going to put some more money into this pot to help these people of low income. The next government comes along and says, well, it's time for restraint. So it's a step forward, a step back. Incrementalism doesn't really solve the problem. Or as Hugh Segal used to say, our present system doesn't fight poverty, it institutionalizes it. And it costs us all billions and billions of tax dollars every year. There are savings that can be made here, not only in administration, but in the impact of such costs as health care, shelters for the homeless, and public safety resources. The Canadian Medical Association once said, quote, "Poverty makes us sick," pointing out that the lowest income quartile has twice the health care costs than the highest income quartile. And homelessness costs us 3 to 4 times higher by leaving someone on the street than giving them housing with supports. Also, it isn't just those on social assistance who suffer, but many of the working poor can't make ends meet, even with more than one job. The working poor are substantial users of our food banks, and food banks, as we're seeing in the media day by day, are growing in need, and many of them are, in fact, people already that have jobs but just don't have enough to make ends meet. Giving people a better foundation, this is what it's all about. Giving them a better floor, a better foundation to meet their basic needs will reduce those costs and give them an opportunity to build a better life for themselves and their family. And some of the many pilot projects in Canada and around the world have demonstrated people can become contributors to, rather than dependents of, the public purse. Now there's another savings. There's where go from withdrawing to contributing. Now that's a good investment, and it's a good return on the investment. As you know, there are many estimates on the cost of basic income for the federal and provincial governments. It all depends on the design of the program. There are obviously some that are far too expensive, that don't meet the needs, go beyond what we are attempting to do to get people out of poverty, get them back on their feet, get them into productivity in our society. Well, that's why a framework as recommended in S-233 is needed. As part of that collaboration with the government of Prince Edward Island, who have expressed interest, or any other willing province, it would help to demonstrate what is a workable solution in real life. While there will be transitional costs as you change from system to system, I believe that overall, in the long run, a guaranteed livable basic income will not require more money, but will put us on a path to spending smarter, more efficiently, and effectively. It's time to end poverty and reduce inequality in this rich country we're blessed to live in. It's time to improve equality of opportunity and better sharing of our prosperity. Thank you. Merci beaucoup.
So my question is, like, why is there such a lack of information there to support a basic income? Because there have been a number of pilots conducted over the years, or partial pilots, but there's no data there like that would support it compared to what was produced by Mr. Green out in British Columbia. So can you just speak to that? Would you be able to speak to that? I'd be very interested in hearing why there's no, the lack of data.
Well, I would beg to differ. There is a lot of data. It's true that some of the pilots have not gone on long as were needed to give a very complete set. The MinCom, for example, in Manitoba, or even the Ontario one, when there was a change of government, they stopped. But there is tons of anecdotal information.
Hard data.
Well, there is some hard data in it, but there is a lot of, you have to accumulate it from
Somebody
the very,
has to,
very
yeah, it's
different
not accumulated.
studies. There are a lot of different studies that have brought a lot of data. A lot of universities in this country have done a lot of work, very detailed work out of Queen's University, out of the University of Manitoba. They would all beg to differ in terms of how to translate the information that they've been able to put together into it being good, hard data. Now, that's also why, though, understanding your question, why we need a framework so that we can determine what is the best direction to go in this, to be able to serve people's needs, but be able to have the kind of data that we need to be able to accomplish it. So it's a step-by-step process, and I think it starts with building this framework. And there is a lot of information out there that can be of great value, and if it's necessary to do more pilot to get more data, then do it. But the anecdotal stuff is very compelling, and I don't think we can just drop it because you don't think we have enough hard data. Let's get the hard data.
But when Mr. Green appeared, they have a comprehensive report, and he was able to speak to it in like a broad perspective. But when you speak to other people who participated in pilots, or even like like former Premier Wynne, you don't get you don't get the feeling that it's been wrapped up in a it's not all in one place. So it would seem to me that for people who are supporting a basic income a project, that the data would be available and presented in a convincing manner. But I find that the more convincing data is actually in what Mr. Green provided. So it's just. And I should mention that, I spent 3 years as a Deputy Minister of Social Services, so I'm very familiar with all the financial assistance programs. But on one hand, you got a lot of really good information, not supporting it, and then over here it seems like you don't have the same quality of data.
Well, I think there is a lot of basic information. I've seen stories where people have been able to use a pilot project and have got back on their feet, have moved forward, have got better jobs, start to be contributors to society in that respect, as well as to their own lives. Those stories are very compelling, and there are lots of them out there. So that's a good start.
Yes, we can easily see that the gap is getting larger and larger between people who are in a fragile situation and those who have enough. So I know that everything is complex in the Federation, and given the shared responsibility between the federal and provincial governments in terms of tax credits and social, how can we ensure a guaranteed livable income in the context of the Canadian Federation?
Consultation between the federal government and the provincial governments, and we at least have one province that's indicated it's quite willing to do that. And I think I think we've got a lot to sort out in terms of where you start, how you set up the system, the framework that this bill calls for, and that's what we ought to get them to start doing. The main aim here is to get people out of poverty, get them up to a better position so that they can then move forward with their lives. And we've seen in a lot of the pilot projects where that has worked quite well. And I think at the end of the day, it'll pay dividends. It'll reduce healthcare costs. It'll reduce costs in the criminal justice system. It'll reduce costs in terms of administration, the kind of administration that goes on now with welfare, the social assistance programs that are humiliating in many respects for people. So there is a lot of cost savings, and there is, as people get on their feet, ability to be able to move forward with their lives and to become contributors. So I think it's a good investment, but they've got to sit down and obviously work out the parameters of it. There's so many different studies that have been done, and with different conclusions, that's all got to be sorted out, and that's where we need to start.
There's no doubt that Canada, and I share what you said at the beginning, that at first sight, the introduction of a guaranteed minimal income would improve the situation, even though in Canada, if we compare ourselves to other countries, our neighbors especially, there's less of a gap between rich people and poor people. But from a study in 2021 by the Parliamentary Budget Officer, it seems it's not for certain that all categories would benefit from guaranteed basic income. For couples, it's fine, but a single parent with 2 children would actually find themselves in a worse off than they are currently because of the elimination of exemptions and the various tax credits that exist. And that situation varies from province to province. In some provinces, a single-parent family with 2 children would lose a lot more than others. So my question is the following, and this is the PBO who was mentioning this. Do you agree with his conclusions? And how could we deal with this, given that the bill could be higher if we want no one to lose in a reform?
Are different aspects to the design that he looked at, that the PBO looked at, than what others have looked at. I don't think that anybody in a lower moderate income should be reduced in terms of their support. I think we have a progressive tax system, and we've got to treat people in a way that they're not going to be worse off. And there are other designs that could be employed. One of the designs, for example, I think he did employ was the treating even young people as an individual who are still at home, whose parents may not qualify. He or she may be part of a household that in fact has sufficient funds, although the individual may not, being a student perhaps, or somebody in a low-income job. Well, I think you have to look at the household income. And if you do that, then that would be a considerable savings over and above what I think the PBO were looking at in that case. Also, I found, at least in the first study of the PBO, which was just out before I left the Senate, there was not a reduction in the provincial contributions to social assistance. I mean, you take that into consideration, and then you have a different picture altogether. So it depends on how the design is done, and that's what needs a lot more attention. I'm not saying that the PBO was wrong in coming to the conclusion they did, but it was based on the input that they used for it to produce the output. So there just needs to be a better formula.
My question is on incentives to work. The PBO and others say that this would have an effect on encouraging people to incentives to work when we have a strong, high immigration to compensate for our labor shortages. So to go ahead at a time when we have problems with labor, would that create a disincentive to work?
One area where I think there are some hard data statistics that come out of these various studies, not just in Canada but in other parts of the world, where there has not been a substantial diminishing of workforce attachment as a result of the implementation of basic income. We have a strong work ethic in this country. And people, I don't think, are going to be satisfied to just get enough to get by, to get their basic necessities, because I think the kind of plan that we'll end up with will not give people by itself the good life. It'll make sure they have the basic necessities and a little bit of room to maneuver, to get out of debt, to get more education, more training, whatever, to be able to move themselves on to a better life. I think that's what people want, and that's I think one of the great benefits of having this is they want to be able to get ahead of life and to get out of the situation that they are so miserable in.
Thank you, Mr. Eggleton.
In 2020, you co-authored with the former late Senator Hugh Segal in support of a national basic income program. You were hopeful that the patchwork of COVID-19 support programs would provide many lessons learned in the design of a more permanent income security program for the future. Almost 4 years later, with many of the support programs sunsetting, I'd like to hear your thoughts on what were some of the lessons, or what are some of the lessons learned which you feel are important to consider moving forward?
You mean out of the COVID experience?
Well, let's put it this way. The COVID programs provided great relief for many Canadians. Yeah. And I guess you could assume that if you had a parallel between the potential of these programs being implemented later on, you could use that as a basis to form another basic income program. So I'm just wondering, from that whole experience, what lessons have we learned?
Well, I think we certainly learned that people made improvements in their lives. Now, I'm not suggesting that a basic income program be designed along similar lines. That was to meet a particular circumstance. It was to get it out the door very fast, which it did. This one can be planned a lot more in a targeted fashion to bring people out of poverty. So I think the lesson learned is that giving people more income security will improve their lives. But one must be very careful to be fiscally responsible about how this is all developed.
The people who would be potentially against implementation of such a program, what needs to occur to try to get those people on a more positive direction towards the formation of a basic minimal income? What do you do with these people that are out there and they're just saying, no, we can't do this and we can't give people this and we can't afford this, which is common? What can we do?
I don't think we can afford the way things are now. Poverty is costing us an awful lot of money. I see a study that came out of, I think, the University of Saskatchewan suggests that poverty is costing us about $80 billion a year. Well, that's an awful lot of money. It's wasteful. We need to help people, not put barriers in front of them that they as a result find themselves in considerable stress and anxiety and can't get ahead in life. I'm not suggesting, some people say, well, you're giving people a handout. No, I think we give them a hand up. We give them the opportunity to improve their lives. I think the data that comes forward about the studies in terms of the work ethic are also an indication that people aren't just dropping out of the workforce. They want the MinCom experience, for example, in Manitoba. What it found, the only people that were really dropping out were people that kids that wanted to go back to school, young people that wanted to go back and get a better education and get ahead in life. I think more of those stories, more of that information needs to be out there because I don't believe in the long run this will cost more money at all, and it certainly can be implemented in a very gradual basis. They've decided, the government's decided it wants to implement pharmacare, for example, but it's not going whole hog into it. It's saying, look, we'll start with this more limited measure, but we'll get there eventually. And I think I think we can do that in terms of getting the framework developed and getting into basic income, hopefully in PEI.
Thank you.
Thank you.
I wonder if you might give me your perspective. Those who participate in a guaranteed income program, do you believe that it would be a transitional program or a permanent program? And in order for it to be transitional, how could people be motivated or incentivized to no longer be on the program? Or would you see it as a permanent program for some?
Well, I certainly from my experience over the years and meeting with people in communities right across the country, and I also had a municipal perspective at one time as the mayor of Toronto for some 11 years. I think most people want to be able to get out of the struggle they're in. Whether they're working poor or whether they're on social assistance, people are disabled. I mean, that's a crying shame for so long. They have been struggling to make ends meet. There's just an epidemic of stress out there. And as people can get out of that situation, then they will do everything they possibly can to move forward in the best way possible for them. Sure, there are going to be people that won't, or people that will take advantage, perhaps abuse the system. But I don't think we design a whole program just based on that. I think we should be designing a program that'll serve the vast majority of people who want to get out of the predicament they're in and who want to become contributors to society. Just think of all that additional support and productivity to our economy that could be made by these people, plus all the savings in terms of the great amount of healthcare costs and everything. People don't want to be in that state any longer than they have to be. So the sooner we can get a program that gets them out, the better off we'll be in our society. And I think we'll set a good example. We have set examples in other programs. At one time, they would have said Medicare. We can't afford it. It's too expensive. Oh, we got to deal with all these provinces. It will never happen. Well, it did happen. And, child care. For years, it was said, we can't get the provinces to agree with us on child care program. Well, but we have one now. It's not perfect. There's a long way to go in making sure it does work. But let's get moving on this because I think it'll pay dividends.
Senator
If I
Ross?
heard you correctly, yes, thank you.
Please.
If I heard you correctly, what I'm hearing is you think a program like this should be designed to motivate and incentivize people to be on it for a briefer period.
Absolutely. And I think it will. And I think there is a lot of evidence to that effect in the studies, even though some of these studies have been short or incomplete and have had different designs on them that produce different kinds of results. Nevertheless, there are some common threads through all of them that indicate that, yes, people will take advantage of the opportunity. If you give them some income security, they'll take advantage of the opportunity and move themselves forward.
Thank you very much. And thank you again to both Mayor Alto and our former colleague, Senator Eggleton. I wanted to come back to the question that Senator Marshall raised about disincentives to work, because in fact when Professor Green was here and in their BC report, they talk about a basic income not having an appreciable negative impact on the workforce participation. As well, Dr. Jiaying Zhao, who testified, who's doing the cash transfers, is already documenting the very thing that Senator Ross also talked about, which is that by providing a lump sum payment, which is another model, it could be a model that would be incorporated or not, that they're seeing really, really quite quick results out of homelessness within 3 months, many of them employed within 12 months. Those are pretty amazing stats for data which we know in the social assistance system is quite the opposite. It keeps people entrenched in poverty and uses negative approaches and moralistic approaches rather than incentives to work, like the Ontario pilot. So I'm curious if either of you have more to add to that. And also, I know that when I first met you, Senator Eggleton, you weren't necessarily a supporter of basic income, and I think it might help some of the folks listening in the public, as well as some of my colleagues, to hear how you moved to that place of supporting basic income, because I know it wasn't always your view. And Mayor Alto, I'd like to hear how you came to this position as well.
Well, I initially, when I teamed up with Hugh Siegel and we did the report through the Social Affairs Committee in from the margins, I said let's be careful of how much we press the basic income, because I'm not sure at this point that is part of the answer. But as I got involved in meeting people from coast to coast as we were doing that work, that study, and the follow-up to it afterwards, I became convinced that really was the way to go, because in terms of either working poor or people on social assistance or people that are disabled, I would see governments that would come forward, provide some additional funds, and then another government would come and more or less take it away or freeze it for a period. So incrementalism in that respect to the current systems was not working. Plus the patchwork of programs and services and the conditions on them just drive people crazy in terms of having to spend so much time trying to comply with all of these things that, you know, one has to put some trust in people who want to move forward to be able to do that, figure out how to do that best. And I became convinced that it would work better that way than the current system would. So Hugh helped get me started on it, but I am very convinced that this is the only way that we're really going to get out of the poverty that we're in. We still have, you know, yes, we do have the Canada Child Benefit. We do have the seniors programs, which combined are a form of basic income. Hopefully we'll soon have something for people in disability. Yes, we have these, but we still have 3 million people in poverty in this rich country of ours. And I think as part of doing all of that as well, we need to review our income tax system. The last time that was done was the Carter Commission back in the 70s. It's time to do it again.
Thank you, Senator Eggleton.
Do you believe we still have the fiscal capacity for such a policy today?
And we do have a province that has all party support to be willing to do that. And I think that they, together with the federal government, can design such a program that will work for them. And I think from there, just as Medicare started with just one province, it could then become and should become a national program. So I think we've got to have the will, the political will to do this. We can do it if we can get the governments together to get the framework in place and then to actually implement it. Now, yes, there's the fiscal framework always has to be considered in all of this, and you know, I know that full well. I'm a former member of this committee. I'm a former Treasury Board minister. But I think in the long run, as I said, it'll pay for itself because of the savings in terms of the healthcare and the other things that are costing us more than what they should because of poverty, and in terms of turning people's lives around, getting them in a position where they can advance themselves. Because a lot of people on even the limited pilot projects that were done did get a change of life in their life that was much to their advantage and the advantage of our country.
We would be one of the first countries to adopt a guaranteed livable income. And given where we are at this point in time, could you provide examples of where else in the world it has been adopted and is successfully ongoing?
Well, there's lots of different designs, and they come from different purposes. One in Brazil, for example, has for quite a number of years proven to be quite successful in attempts to better educate people. But it's all, you know, you do some things for the kids. It also helps the parents, just like the Canada Child Benefit does in this country.
So poverty in Brazil is extremely high.
Oh, yes, it is. But there are different programs that can help make it less than what it is, so in many different places in the world there has been attempts, and they have made a difference. And so we would design ours differently. We wouldn't design it.
But is there anywhere where it is ongoing at this point in time successfully, and not just a pilot project?
I can't name one offhand that continues to be on a permanent
I'm saying
basis.
Successfully reducing poverty, obviously, and reducing that gap.
Well, but there's successes that have been a number of these projects that have been held, some of them at the municipal level in the United States and different parts of the world. There's the program in Finland. So they've all produced positive results. Would any of them be exactly like the thing that we want to produce here? I think we're going to produce something that's distinctively Canadian, and I think we can make a big difference by doing it.
My first question is to Honourable Eggleton. I'm just wondering, from your experience working in government, from the municipal level to the federal level in many important roles, I'd like you to comment on what the development process set out in Bill 233 would involve, and what would it look like in practice to bring together all levels of government to develop a framework on guaranteed basic income. And I'm thinking of there's many different things like jurisdictional issues and navigating all those issues. Not all provinces get along well together. So there's many issues. So I'd like to get your comments on that.
Well, there are good examples of where the different orders of government can get together. It happened on the child care program. There are the mechanisms for discussions at different levels. One of the things that I remember that worked particularly well with the three orders of government was on a municipal basis, you could determine what the priorities were in the municipality and get a team together that involved people from all levels of government to work towards the solutions to it. So if there's the will to do it, you can find the formula. You can put together the formula to do it. This bill will help in terms of the federal government taking a lead role, but it needs to bring together, of course, the provinces and the municipalities that can design the kind of program that will do what we want it to do, to get people out of poverty. There has to be a will to do it, though. That's what's important. But there's been will before, so it can be done again.
So do you foresee big challenges? Do you foresee big challenges in getting?
Well, it's obviously going to be a challenge to get all the right data together and to look at a very complex set of programs and services that are intended to help people deal with poverty, to design a better system. So it will take a fair bit of work and should involve all three orders of government in putting it together.
So I'd like to ask the question of Senator Eggleton as a former senator and not as a former federal minister or a mayor. So one of the responsibility of the Senate is to protect regions, provinces, and the Constitution. Under our Constitution, all social services are in the jurisdiction of provinces, and the only social program delivered by the federal government is employment insurance after a constitutional amendment which allowed the federal government to do it. What we're proposing here is to replace all provincial social programs by a unique program telling the provinces what to do in their jurisdiction, which is the administration of social services, the services of last resort, services to students, minimum salary, the taxing of benefits and all that. I understand the desire of people to say that there must be a guaranteed minimal income or basic income, but don't you think it's up to the provinces to decide and that we're the wrong form? We've are trying to use the federal parliament to do something that is not a federal jurisdiction and using the Senate that's supposed to represent regions.
Here is an income security measure, not all social programs that are needed to support people in our population, particularly those who are in low income. There still will be all those programs that are by and large delivered by the provinces. The federal government is supportive of many of these, housing, for example. Now, this is something that does involve all three orders of government, and the federal government is in a supportive role there. But what we're talking about in terms of basic income is an income security program, and income security, there's lots of federal involvement in that. There is for seniors. For example, there is the Canada Child Benefit. These are cash programs. These are programs where people are being given money. Now, you still have to work with the provinces on that. The provinces might be quite happy to let the federal government take more control over an income security program, but they'll want to make sure that they are part of the discussion. So those discussions, just like on the healthcare plans, where the federal government is in a supportive role with the provinces. It allocates money through a system of discussions with the provinces, and we'll need to do that in this case too. But income security is really what basic income is about, not the whole realm of social support systems.
If I understand you, you're not really in favor of the devolution of existing programs.
Existing now, because I think the study from the budget officer is really based on the replacement of all the social programs by this kind of universal program.
I don't think so. This cannot replace all the social support programs. We're still going to need housing. We're still going to need childcare. We're still going to need education. And here the different orders of government obviously have to work together, and the implementation is by and large under provincial responsibility, and to a great extent is delivered by municipalities. That would continue. But in this case, we're dealing with an income security program.
I'd like to sort of tag on to a lot of what's been said by the other senators. But first of all, my observation has been over time that if you're looking at a program and wondering if it's going to be effective, two of the things you have to think about is it integrated and is it comprehensive? And so integration speaks to, in my mind, taking all the good things that are happening in each of the provinces and across the country, applying a bit of best practice, if you will, to some of that, and looking at, if I'm getting a job, I look at total compensation. I don't just look at sort of what money actually comes into my account, but there's other things. And I see those programs that are in the provinces now, with the help of the federal government very often, being part of that total compensation. For instance, if I'm a single mother and I need a basic income, absolutely. I also need quality childcare in order to be able to do my job and to be able to look to the future of a better career, if you will. That's just an example. Also, to the point of data, there have been things done around the housing first philosophy. And we do know that savings are being made there, and there's data to support that. The City of Calgary did a wonderful job of keeping data on their Housing First project and the decrease in the number of emergency visits, the decrease in policing costs, the decrease in brushes with the justice system, if you will. And our little city of Fredericton actually replicated that study in a very small project, but they looked at how many people, the people that were in that Housing First program and were supported in their housing, and you spoke to that at first, how over a year, drastic decreases in the number of visits to the emergency room and so on and so forth. So I think what I'd like to ask both of you is, you talk about this, it being, the framework being a living framework. I think that was you, Yes.
Mayor Alto. And so I'd like your comments on, this is a framework, and in fact in the bill itself it speaks to the other services that will be necessary. So how do we produce something that's not just a check in the mail, but is an integration of a package of programs or a basket of programs that makes a comprehensive support for people that are living in poverty?
Income security is a vital part of the answer, but it isn't the whole answer.
Exactly.
It has to be integrated with all these other things. Childcare is very valuable for people to get ahead. If they get a little bit of extra money that helps them with an education, training, get a better job, but they still are going to need childcare. They're still going to need affordable, decent housing. So those have to be still key support systems for people in our population. But the scarcity of money in day-to-day living, getting nutritious food on the table and the basic necessities, and the kind of stress that goes with that is a big part of this, and that's why we need a basic income plan. But you can't forget the other support services. You know, you mentioned people for Housing First. There's an example. There's a lot of hard data on that too. There's a lot of hard data that says it costs 3 to 4 times to leave somebody on the street than it is to give them decent housing and support services. These are people, if they're left on the street, they're in and out of emergency wards and hospitals. They're in and out of jail, perhaps. They're certainly in and out of shelter accommodation. And you look, and there are very hard costs in all of that are easily put together and quantified. And the studies indicate that you would save an awful lot of money by having better support services for those homeless people.